Physique assessment. The question our expert panel addresses is, as a healthcare practitioner, should I consider purchasing equipment to monitor the body composition of my clients? If yes, what should I use? Associate Professor Gary Slater.
The question of whether or not someone should make an investment in the purchase of equipment to monitor body composition is something I'm asked very often. And it makes sense in some regards. If you're a healthcare practitioner that is working with an athlete to change their body composition, I think it's really important that you should be tracking their body composition. To be honest, I think it's unprofessional if you're working with a client to change composition if you're not monitoring it. The question is this something I can do in-house, or do I need to outsource expertise to be able to provide that service? In general, what I would suggest for healthcare practitioners that are working with athletes to change body composition, get some qualifications associated with surface anthropometry. That in itself may be enough for you to be able to track changes over time. These more advanced, more expensive techniques, such as DEXA for example, might appear appealing, but you really need to understand the technique itself before you could consider the acquisition. You also need to give consideration to the cost implications. Now you can buy bioelectrical impedance equipment relatively cheaply, but how reliable and robust is that measurement? For the more expensive techniques, there's also the cost implications of maintenance. And so in general I would suggest acquire that surface anthropometry qualifications and skills so that you've got a high degree of proficiency in that assessment, and then consider outsourcing to groups that you trust that can capture high quality data when you need or want an absolute measure of fat mass or an absolute measure of fat-free mass.
Dr. Kagan Ducker.
I think definitely you can consider buying equipment to monitor someone's body composition, but I think the first thing you really need to do is go out and get some training to ensure that you are actually able to collect some valid and reliable data using a bunch of different methods that you might have available, and then you need to choose the tool that you're going to have access to. So that might be as simple as purchasing an anthropometry kit, or as expensive as purchasing something like a DEXA scanner. But at that point you just have to choose whatever you think will give you reliable and accurate measures that you can use with your clients.
Professor Tim Ackland.
Okay, so this depends on the accuracy and reliability required of your measure, and also on the budget available. So for low-cost technologies, we would suggest the use of anthropometry and skin folds, as well as the ultrasound technique. For a DEXA scan, however, you might consider purchasing or outsourcing to a service provider.
For further information on physique assessment, see our book, Best Practice Protocols for Physique Assessment in Sport, published by Springer.